let's talk about the medical options for these men as well as the surgical options. What is available to the male today that you can treat medically to help improve their sperm count?
Well, there's a vast array of things that you can do to treat the husband medically, and it really depends on what the cause of the problem is. So, for instance, if there's some sort of hormonal issue that's preventing normal sperm production, then there are a vast array of oral medications, sometimes even injectable medications that can be used to either stimulate that or replace that. If there's some kind of problem with infection or inflammation, then you can treat that sometimes medically with agents that would address those specific problems. Even if there's transportation issues, such as difficulties with ejaculation or difficulties with erection, I mean, there are ways in which that can be treated medically. So it really depends on what the cause of the problem is. Sometimes there's the importance of just stopping therapy, because there's definitely certain medications patients can be on that can have an adverse effect on their sperm, like testosterone or like some agents that patients may be on for ulcerative colitis or Crohn's disease. The surgical options tend to really focus again on those areas that you can correct specifically. Probably the most common operation that's done is a varicocele correction, which happens in about 40% of patients who have a production problem and are then subsequently infertile. And then if there's any kind of obstructive issue, whether that's a patient that's had a vasectomy, whether that's a patient that's developed some sort of stricture or stenosis due to infection, then those can be treated surgically. And then there's a group of patients that either because there's such low production or because they don't want to correct their obstructive process, might opt to do sperm retrieval techniques, which is a surgical option where you would obtain sperm from some reservoir in the husband, and then that sperm would be used with in vitro fertilization. And the great thing about those techniques is those have really salvaged a whole group of patients that previously were deemed terminally or sterile, and as a result had no options. But now we're able, probably I would say in about 80% of cases, to offer even patients with severe fertility issues the possibility to establish a family.
Now, before you joined our practice, we had always seen urologists performing testicular sperm retrievals under general anesthesia. Can you tell us how you actually perform these procedures?
Well, most sperm retrievals you can do under local anesthesia. And that's really if you're using magnification, because then that helps you to keep a very small surgical field. And if you're dealing primarily with an obstructive case, then going through the skin as opposed to making an incision and being in a major operating room, you can isolate that with testicular mapping procedures and go right where the sperm are with really minimal amounts of invasion. Even if you have to do an open procedure, many times those are done through fairly small incisions that really don't require a lot of anesthesia or a lot of physiologic disturbance. So with those techniques and just with an experience of using those techniques, it's really pretty minimally invasive for the patient.
It's such a relief to the couple to know that if the man is producing no sperm, they can still potentially be able to receive a sperm from the testes and obtain a pregnancy. So it's really, really remarkable. One thing that you mentioned earlier about a varicocele, could you just talk a little bit more, because it's so common and there's still a lot of confusion about what do you do with a varicocele and when is it clinically significant enough to treat?
Well, that's a good point, because I mean, even the medical field's confused exactly about what to do with varicoceles. A lot of that has to do with how the studies are designed, but varicoceles are pretty common in the male population. You'll see them in about 15% of men, but not all of those produce a problem. So the critical thing is determining which of those are really creating the problem and then as a result need to be addressed. In about 40% of cases in men who have a varicocele, it will be affecting sperm production. And that doesn't necessarily mean it has to be treated at that point, but it's that you want to give the patient the option to treat it. Now, times where all actually many times require treatment is if the varicocele is affecting testosterone production, because down the road that can have really long-term implications for their health. But the rules now, at least in regards to a varicocele, is it needs to be visible and palpable, and then it needs to be having an effect on sperm production. So if it's doing those two things, then it's pretty clear cut that in about 60% of cases with correction, if there's no maternal factors, that you're going to be able to establish a pregnancy over the next year. But you really have to meet those two criteria. before you would advocate correcting it for fertility reasons.